This chapter is all about skeletal system. We're going to talk about all the bones, the parts of the bones, and developmental aspect is very few that we want to go through. So that means there's a lot of names in this chapter that you need to know. That means you need to know all the bone markings from chapter 6 that we went through. You need to know that by heart. Lot of repetition, revision is required for this chapter. There are a lot of pictures in Pearson websites that you can go and quiz yourselves as well. Now let's start with the chapter. So the skeletal system is divided into two, axial skeletal system and appendicular skeletal system. We're going to start off with the axial skeletal system, which includes 80 bones. It includes the skull, the vertebrae, and the thoracic cage. So over here you can see all the green stuff that is in this picture are all axial skeletal system, and the yellow one are all appendicular skeletal system. Okay. Now, let's start off with the skull. Skull has two sets of bone, the one that holds the brain and the one that has a face. So you have the cranial bones that forms the cranial vault, and then the skull, the facial bones, which forms the face of your head. Okay, it is for air, food passage, for all the organs, like special organs like eyes, nose, tongue, all that stuff. Okay, we're going to start off with the cranial vault, which includes bunch of bones. Let's talk about those bones. We have your frontal bone, you have your parietal bone, occipital, temporal, sphenoid, and ethmoid. Under each bone, there are certain parts that I want you to remember. The frontal bone is one single bone. Parietal, on the other hand, you have right and left, two bones. Same as for temporal, two bones. Occipital, one bone. Sphenoid, one bone. Ethmoid, one bone. You need to imagine your skull in a three-dimensional view. Your pictures do not justify. You have to imagine in three-dimensional view. Frontal bone is where your forehead is. So if you look at this picture, this part that forms the anterior cranial fossa, which holds anterior part of your brain, includes your frontal bone. So you can see how the frontal bone comes from here and goes L-shaped. So you can see how the bone itself this is the frontal bone. It starts over here and goes all the way like that. And when this part, the L shape, this portion is what we are viewing in this section right over here. So this L shaped right over here forms the cranial fossa. This bone right in the center that you see is a different bone. That is not part of frontal bone, okay? And then the sutures that you're seeing over here and here is part of another bone. So this starts another bone. So the frontal bone is all these. Right over here is your frontal bone. Okay. It has air-filled sinus. Basically, the sinus is in this area, right over here. Okay, you're gonna see two sinuses. You have to cut the bone in half to see the sinus. Sinus is nothing but empty pockets inside the bone. Okay, so over here, that's the reason why you have headache when you have sinusitis. Right over here are the frontal bone sinus. Okay, let's move on to the parietal bone. Parietal bone are this pinkish bone over here. Okay, you have one on the right side, one on the left side. If you look at the parietal bone on the side view, you're gonna see them joining right in the center. So there's a suture over here. Suture is the fusion of two bones, right? That's the suture. So you have left side of the cranium and the right parietal bone of the cranium. Okay, there isn't many features in the parietal bone. Let's move on to the next bone, which is the occipital bone. Occipital bone is a posterior bone. It attaches to the parietal bone, okay, superiorly, and moves on laterally. And then you have the attachment to the temporal bone and the occipital bone over here. Okay, you can feel all these bumps in the back of your head. So you have your superior nuchal line right over here, and then your inferior nuchal line over here. So those are the parietal bone. And in the center, you have external protuberance, Okay, external occipital protuberance. That's what you feel in the back, jetting out, right? That's your external occipital protuberance. If you look inferior view of your occipital bone, so you're going to see something like this. The inferior view is going to have this. So here's your external protuberance, occipital protuberance. And there's a huge foramen over here in the center. This foramen is where the medulla oblongata becomes spinal cord. The spinal cord starts from here. So that is foramen magnum. And then right next to the foramen magnum, you have two bean-shaped structure that forms your occipital condyle. Occipital condyle is where your vertebrae sits on. Okay, so you have the occipital condyle. So under occipital bone, you have the nuchal line, the superior and inferior, your external occipital protuberance, your foramen magnum, and the two bean-shaped structures right next to the foramen magnum, which is called as occipital condyle. Okay, so here you can see the parietal suture between the occipital and parietal, and occipital and temporal on both sides. Okay. All right, next moving on to your temporal bone. Temporal bone is a bit tricky bone, okay? Imagine a bone that is flat on the outside, and then you have cone-shaped structure on the inside, okay? So you have flatter outside part and a cone-shaped inside part. That's basically how your temporal bone is going to look like. It has four major regions: your squamous region, your tympanic region, and a mastoid region, and a petrous region. Okay, so squamous region is a flat-shaped region, so it's going to be over here, and that'll be your squamous region right here. Tympanic region is where your earlobe is. Your earlobe is going to be like this, and your eardrum is going to be over here. So this part area is your tympanic region, where you're going to have outside access to the earlobe, right? Mastoid portion, if you feel behind the ear, you have a mastoid process over here. So this region is your mastoid region. The petrous region is this cone-shaped region that is inside the cranial cavity. Okay, so that'll be a petrous region. Let's look at it in a detailed view. Okay, so here's the squamous region. This whole area is your squamous region, right? Here's the mastoid region. This whole area is the mastoid region. This is the external acoustic meatus, that's where your eardrum is going to be located. So this area is going to be your tympanic region, right? And then you have, if you turn your temporal bone to view the internal structure, if you turn your temporal bone, so here's your temporal bone outside, right this side. Here, this is the parietal, underneath is the temporal. So this area, the cone-shaped structure that you have, that whole thing is your petrous. This will be the part of your squamous, okay? So here's the petrous region. Petrous means wood-like. It looks like old wood, fossilized wood, hence petrous, right? So that's basically how it looks. So all the regions you need to know. So externally, you're going to see your squamous, your mastoid, your tympanic, and then internally, where your cranial cavity is, it forms part of your middle cranial cavity. So the anterior cranial fossa is formed by mostly your frontal bone, and this will be the middle cranial fossa formed by your sphenoid and your temporal, and your posterior cranial fossa is over here formed by your occipital. Okay, so here's your petrous region. Now let's look at all the structures that you need to know. Your temporal bone actually has a lot of processes. Here's your zygomatic process, which forms part of your cheek arch, basically, attaches to the zygomatic bone. So that's your zygomatic process. Mastoid process, which forms the mastoid region. It has a sinus inside it as well. So a sinus, again, is a hollow space inside the bone. And then you have a styloid process, which helps in muscle attachment for your pharyngeal muscles. We'll talk about that when we get to the muscle chapter. So styloid process right over here. External acoustic meatus. Meatus is a canal, right? Meatus is a canal. This is the outside opening of the canal. Okay, the inside opening of the canal is going to be inside your middle cranial fossa. So it's somewhere in this side over here. There's going to be an opening of an internal acoustic meatus that's not seen. Okay, so that's basically what you're going to see in your temporal bone. The next bone that we're going to talk about, so we finished the frontal, we finished the occipital, we finished the parietal, and now we're moving on to the sphenoid bone. Sphenoid bone is a butterfly-shaped bone. They say bat-like structure, but I say butterfly. It doesn't matter which one you choose. It has three processes. It has a greater wing, lesser wing, and a pterygoid process. So let me show you why I say it is butterfly-like shaped. Okay. Imagine you have a body of the butterfly. Okay. You have the wing, have the greater wing, and then you have the lesser wing. Okay, so you have the greater wing and then you have the lesser wing, and the legs are dangling down. Okay, these are the legs dangling down. Okay, so here the so this basically is what I'm trying to say. Okay, this view that you're looking over here is the topmost view. So you're looking from the top because the legs are dangling down. So let me draw a side view of the butterfly. So the legs are dangling down like this, and the wings are over here, okay, on either side. There's the greater wing, and like that. Okay, so the legs are dangling down. The reason why I'm emphasizing in the leg is because it's one of the processes we're going to talk about. So this top view is what we are seeing over here. So here is your, so the lesser wing is anteriorly located. So this will be the anterior side. Okay? So here's your lesser wing, anteriorly located. Okay? So here, you see over here, this horn-shaped structure, that's your lesser wing on both sides. This is your lesser wing on both sides. Okay. Underneath that, this whole area that you see is your greater wing. Underneath that is this whole area that you see is your greater wing. The importance of this is it actually forms a part of your orbits. Your greater wings and your lesser wings forms a part of your orbit. So how's that going to be? Let's look at this picture. So do you see over here the pink structure, right? So that basically is your sphenoid bone. So you see the greater wing and you see the lesser wing over here. So that's basically what I'm trying to say. So here in this structure, once again, you are seeing that underneath this area will be your eyeballs. Over here will be your eyeballs because it's in the part of your orbit. Now let's look at the body. So you have the wings down. This entire area right in the center is the body. Okay. The body has a fossa. This is where your pituitary gland is going to sit in. It's called as hypophyseal fossa of sella turcica. Sella turcica, saddle of a horse, right? Okay, so that's hypophyseal fossa of sella turcica. If you go right above that depression that you're going to see over here is the opening of the optic canal. Optic canal through which the optic nerve comes into, right? So you have the two optic canal over here. Then if you go to the greater wing, you're going to see three actually, foramen. So the one foramen right underneath over here is your foramen rotundum, round-shaped foramen. Below that is your oval-shaped foramen, foramen ovale. And then you have a tiny one over here, spinosum. Okay. Foramen spinosum. So that's all the structure you're going to see from top view, superior view. Okay, let's move on to a posterior view. Posterior view is right over here, the bone. So you're looking from this direction, right over here. Okay, so when you look in the direction, you're going to see the two dangling legs. This whole thing is your pterygoid process, P silent, pterygoid process. Okay, so from the posterior view, you're just viewing as though you have cut open the skull and you're looking at it from this side. So you've removed all this part away and you're looking straight at it from the back. Okay, then you see the legs dangling. So over there you can see the pterygoid process. You can see the lesser wing on the top, greater wing over here, and the orbital cavity will be from this side. Between the lesser and the greater wing, you have a fissure. Fissure is a slit between two bones. There's a superior orbital fissure, and there will be an inferior orbital fissure that we'll go through. So here are your pterygoid process. Let's go back again. Your sphenoid bone, in your body of the sphenoid bone, you're going to have sinuses over here too. So you have sphenoid sinuses over here as well. A big space in the body of the sphenoid is sphenoid sinuses. So that completes your sphenoid bone. So we need to know the wings, the processes. That'll be your greater wing, your lesser wing, your pterygoid process, which are the legs, right? And then the body of the sphenoid. You need to know the optic canal. You need to know hypophyseal fossa of sella turcica. You need to know the foramen, rotundum, ovale, spinosum in that order. You need to know how to identify them as well. If you look at the posterior view, you can see the pterygoid process. Make sure the spelling is right. P is silent, pterygoid process. You need to know the fissures, superior orbital fissure and the inferior orbital fissure. That completes the sphenoid bone. We're moving on to the ethmoid bone. Ethmoid bone is a bit difficult. Okay, you need to see a three-dimensional skull in hand. You have to hold them to see where the ethmoid bone is. Okay, the ethmoid bone, if you remember from this picture, I told you that this is all frontal bone, the yellow, but in the center, right over here, is a different bone. This bone is part of ethmoid bone. Forms part of your anterior cranial fossa, and it actually has an elevation. So you're looking from the top, but if you see the side view, it's going to stick out like this from the fossa. Okay, it has an elevation, so your frontal bone starts over here, goes all the way to top. It's not this high, but you get the point, right? It sticks out. Okay, that sticking out point is called as crista galli, right over here. And around the crista galli, you see these perforated plate of bone. That bone, perforated bone, is called as cribiform plate. Those holes that you see, perforation themselves, are called as olfactory foramina. Because they sit right on top of the roof of your nose, they sit right on top of roof of your nose, the olfactory nerves on the roof of your nose comes through these olfactory foramina and enters your brain. Brain sits right in this area, right? So enters the brain. So that's the purpose of cribiform plate. So this plate is what is stopping your brain matter from your nose. That's why divers, sometimes they break the nose, the brain fluids, cerebrospinal fluid comes out through their nose. Why? Because they have broken this plate. And from there, it's a direct access to your nose, okay? The roof of your nose. So you have your cribiform plate with your olfactory foramina, and the peak over here, right here, is called as crista galli. Now let's go back and look at more structures of your ethmoid bone. So here's your ethmoid bone. So if you have your, say, I'm going to do a profile picture. So you have your nose, your mouth, and your chin, and you move on like this, and here's your forehead, right? So your cranial, this is your L-shaped forehead, the frontal bone, and your crista galli is right over here, right? This is all your nasal cavity, and the bone itself sits like this. Okay, it sits like this. So it is the deepest bone, and behind that you have the sphenoid bone. Okay, you have the sphenoid bone spreading its wings on right and left side. You have the sphenoid bone behind that. So here is your ethmoid bone right in the center. This is a profile picture. If you look anteriorly, it's going to be like this. It's a very poor picture. So your ethmoid bone, that's your lateral view. So if you look at your anterior view, if you remove all the facial bones, you'll see that ethmoid bone spreads out its mass on either side like that, right? So you have like this and spreads out like that. So this mass is what I'm talking over here. This area, this whole area goes on the right and left side, okay? So in the center, you have a straight plate, okay? It goes straight down. That's as straight as much as I can go. So this is the straight plate that I drew right in the center, right here. So that straight plate going down is what we call it as perpendicular plate. Okay. And this mass over here are all called just that, left lateral mass and right lateral mass on the side. This mass contains spaces, empty spaces within the bone called as ethmoid air cells. There are tiny sinuses. They're basically tiny sinuses, hence they call this air cells. That's why your face also hurts as well. Somewhere deep inside, you can't point out where it is. That's basically your ethmoid air cell sinusitis. And here's your cribriform plate. So that this cribriform plate is where it's going to be on the side of the crista galli. Crista galli is jetting into the anterior cranial fossa over here. On both sides, you have the cribriform plate with tiny holes, olfactory foramina. I hope I was able to explain. So you have the crista galli going upwards, the lateral mass going sidewards, and right down the center, it forms your perpendicular plate. Now there are other bones that are curved. You see these structures? They're curved. So you see how it kind of folds around like that? So this one right here folds around like that. Those are called as nasal conchae. Okay, nasal conchae is very important because they contribute towards the lateral portion of your nasal cavity. Medial portion, the nasal septum itself, you have your perpendicular plate contributing towards that. The lateral portion of the nasal cavity is because of the nasal conchae, right? You have your middle nasal conchae and you have your superior nasal conchae as well. So you have all those structures in your ethmoid bone. Let's look at them anterior view and you'll see the same thing over here. Okay, so the oranges bone that you're seeing behind your nasal bone is your ethmoid bone. So you can see the middle nasal conchae over here on both sides and the perpendicular plate coming down to form your nasal septum. Okay, so upper portion of the nasal septum is formed by the perpendicular plate, and the mass, the lateral mass, will be behind in this area in general vicinity. So that would be the lateral mass. It is tricky to look at a picture and see your ethmoid bone. You have to have the three-dimensional view. That basically concludes all the main bones in your cranial cavity. There are sutural bones. Sutural bones are tiny bones like you see over here between the sutures. Now let's talk about the sutures. How many different types of sutures do you have in your cranial vault? You have the sagittal suture that connects your parietal bone. You have your lambdoid suture that connects your temporal to your parietal bone. And then you have the coronal suture or frontal suture, which connects your frontal bone to your parietal bone. Okay, so those are the main different sutures that you have in your cranial vault. So that completes cranial vault. We're moving on to the facial bones. You have many bones under your facial bones. You have your mandible. Mandible is the lower jaw, which is one, actually fusing of two bones together, but it becomes one eventually. You have the maxillary bone, which are two, right and left. Zygomatic, two, right and left. That will be your cheekbone. Nasal bone, right and left. Lacrimal bone, right and left in both the orbits. Palatine bone, two bones that fuses right in the center to form your hard palate along with your maxillary bone. Vomer forms part of your lower nasal septum, and inferior nasal conchae, which is two, that forms your lateral inferior wall of your nasal cavity. We'll get to that. Let's start with the mandible. It's a lower jaw, strongest bone of your face. So here you have the U-shaped mandible. It has a region for the teeth to be located that is called as your alveolar margin, where your teeth sits. Underneath the alveolar margin on both sides, you have two foramen, mental foramen, through which your nerves and everything goes inside to basically innervate your teeth. You have your coronoid process right over here. Make sure you know the spelling, coronoid process. The temporomandibular joint, that means the mandible forms a joint with the temporal bone that forms your jaw joint. Basically, it is formed by the mandibular condyle of your mandible to the mandibular fossa of the temporal bone. You see how the names are. You have the mandibular condyle and you have the mandibular fossa in your temporal bone, meaning the fossa is for the mandible, hence mandibular fossa of the temporal bone. So make sure you keep the names straight. So here's the mandibular fossa of the temporal bone, and the condyle sits right on that fossa to form your temporomandibular joint, TMJ. Okay. Here's the angle of your mandible, and this whole region that you see is the ramus, or the hand portion of the mandible. Okay. So that's the ramus, followed by the body of the mandible. Inside, if you view inside, there's another foramen called as mandibular foramen. So that's basically what you're seeing over here. That's all for mandible. Moving on to the maxillary bone. There are two bones, paired bones, so you have the right and left side. These are fused bones. They are not movable. Unlike your mandible, which is the only movable bone that is found in your cranium and the facial bone, this is not a movable bone of your facial skeleton. What you need to know about your maxilla, it's a paired organ. It forms part of your orbital surface. It has a foramen, infraorbital foramen. Okay, it has the alveolar margin of the upper teeth. And you have the zygomatic process of your maxilla. Okay. When we were doing the temporal bone, we saw a zygomatic process. That is zygomatic process of your temporal bone. This is zygomatic process of your maxillary bone. The process is named after which this structure attaches to. These two processes, both from your maxilla and your temporal bone, attaches to a zygomatic bone. So if you look at the picture, the small picture over here, you can see the zygomatic process of the temporal bone. And here's the zygomatic process of your maxillary bone right over here, a small structure, right? And here, you see this right over here, like an arrow mark? That is your zygomatic bone. So zygomatic process of your temporal bone, zygomatic process of your maxilla joins to the zygomatic bone itself. Okay? So the bones and the processes are named after where it goes. Okay? So here, the gray, kind of purplish gray, the bone that you're looking at, this whole thing right here, right, goes all the way over here. This whole thing is, and it goes deeper inside part of your orbit as well, is your maxillary bone. And here's your infraorbital. Infra means below, orbits is right over here, infraorbital foramen. Okay, that's all you need to know in the maxilla. Moving on to the zygomatic bone. There are no parts over there except that these are your part of your cheekbone. So if you look at this picture right over here, you see that this bluish gray area, that's your zygomatic bone. It attaches to your temporal, anteriorly to your maxilla, superiorly to your frontal bone. That's basically how your zygomatic bone, and partly your parietal as well. Okay. All right. Let's move on to the smaller bones in your face. Those will be your nasal bone. Nasal bone are these dark purple ones, two nasal bones that forms the bridge of your nose. The lacrimal bones are the green ones that houses the lacrimal sac, which is your tear sac, and that's basically found within the medial walls of your orbits, right? Lacrimal bone. All right, let's move on to the other bones. Palatine bone. Palatine bone, it's a tricky one, and so is the vomer. So here is your palatine bone. Okay. See over this greenish area? That's your palatine bone. This is your maxilla right over here. Maxilla, I said there are two, right and left. When it forms your hard palate, anteriorly 2/3 of your hard palate is formed by your maxilla, and the process is called as palatine process. That's what you're seeing over here. So over here you're seeing that this 2/3 anteriorly is all your maxilla. You can say it's maxilla because you have the teeth in the alveolar margin of your maxilla, upper teeth. And then this portion right behind is your palatine bone. Okay, this is your horizontal plate of your palatine bone, right over here. Horizontal plate of your palatine bone, and this will be the palatine process of your maxilla. Palatine process because it goes attaches to the palatine bone, hence the palatine process. Okay, so this is the inferior view of your palatine bone. Let's look at something different. Now here is the lateral view of your palatine bone. Okay, palatine bone is something like this. So you have the L-shaped structure going like that. Okay, if you look laterally or even posteriorly, you're going to have something like this. Here's the perpendicular plate of your palatine bone. That's right over here, right? And this right here is the horizontal plate of your palatine bone. So you have the two L-shaped structures joining together, right? So this is basically what you're seeing over here. This is this area, that's the perpendicular plate. And this over here is the fusion. They have cut it right over here. So that's why you're seeing from this side you're viewing. Okay, this picture is from like that. So they have to cut over here. So this is the horizontal plate of your palatine bone. The perpendicular plate of your palatine bone forms the lateral surface of your nasal cavity. Okay, so it forms here's your nasal cavity right over here, cone-shaped structure, right? That's basically how it forms. So it forms posterior part of your lateral nasal cavity. And right behind that, here's your pterygoid process of your sphenoid bone. Here's the body of the sphenoid with the sinus over there, and the pterygoid process right over here. So right in front, you have the palatine bone. Okay, so you have the palatine bone, which basically is a perpendicular plate forming the lateral nasal cavity. So your nose is right over here. If you cut your nose, all the cartilage in the front, right over here where it used to be, the nose used to be, if you cut it over here, you're going to see a triangular shape. Okay, we're going to get to that later. So again, palatine bone, you have the perpendicular plate and you have the horizontal plate. Horizontal plate plays an important role in forming your hard palate. The anterior 2/3 is formed by your maxillary bone, palatine process. The posterior 1/3 is formed by your horizontal plate of your palatine bone. Again, a lot of revision is required for you to understand this topic. Okay? All right. So that basically is your palatine bone. Now let's look at the next bone, which is the vomer. Vomer is interesting. So here is the septal cartilage that you can wiggle your nose, right? So basically, the septal cartilage is where you can actually press it and move it. And that's the septal cartilage. Okay, this is the area where they do plastic surgery on. Shave off some nasal bone as well. Now, when you go deeper, when they say I had a deviated septum and I had to fix it, this is what they're talking about. These areas, these structures are what they're talking about. Crista galli from your ethmoid bone, cribriform plate. I said right down in the center you have the perpendicular plate of your ethmoid bone. So that forms the superior part of your nasal septum. Inferior part of your nasal septum is formed by the vomer. So here's your vomer, blue. Okay. So this is the nasal septum, the deviated septum that they're talking about that they required it to fix. So this probably, when it is fusing together, gets deviated, and this is what they're fixing. The septal cartilage, the perpendicular plate of the ethmoid bone, and the vomer itself. Vomer is a single flat bone that fuses with all the other structures. So there's a lot of chances of deviation of the septum. So let's look at the nose. Okay. Like I said, nose is a triangular structure. So you're looking anteriorly of the nasal cavity. So you have two lateral structures and one right in the center. That's the septum. Okay, we just talked about the septum. Crista galli and then perpendicular plate coming from top, vomer from bottom. In the front, anteriorly, you have the septal cartilage. Laterally, you have all these structures. You have the middle nasal concha that I talked about from the ethmoid bone, and superior nasal concha also from ethmoid bone. These are curved bones. You're not able to see the curve. It actually goes like that. It curves like that. Okay? So you have the superior nasal concha and in middle nasal concha coming from ethmoid bone. Inferior nasal concha itself is a separate bone. So those are the structures that you're going to see on the lateral surface or lateral wall of your nasal cavity. Right in front is your nasal bone. Back, posterior to all the nasal concha, you have the perpendicular plate of your palatine bone over here, and followed by the pterygoid process of your sphenoid bone. So that's basically how the lateral wall of your nasal cavity is going to be, and how your nasal septum and all the structures are going to be. Okay. Remember, the roof of your nose is going to be floor of your anterior cranial fossa. Let me emphasize that. So here's the anterior cranial fossa right over here, right? So the floor of the anterior cranial fossa is going to form the roof of your nose. The floor of your nose is going to form the roof of your oral cavity. Okay, that's basically how it's going to be. So the floor of the nose is going to be roof of your oral cavity. The floor of your anterior cranial fossa is going to be roof of your nasal cavity. That's basically how it is going to be. So please make sure that you organize yourself, your view properly before you learn anything. Make sure that you know where the bones are located. Okay, it is a bit confusing when you do not have the actual model in front of you. Okay, so that finishes the nasal cavity. Let's move on to your orbits. Okay, orbits are basically made of a bunch of bones coming together to form that space. So the orbit is nothing but this entire area where it houses the eyeball. Okay, you have different walls for your orbit as well. Roof of your orbit, lateral wall of your orbit, and medial wall of your orbit, followed by the floor of your orbit. So you have 4 walls for your orbit. So let's look at the roof of your orbit. The roof of your orbit, basically over here, you have the frontal bone. You see the frontal bone over here. This is all frontal bone. Right here. And partly your lesser wing of your sphenoid. Let's move on to lateral. Lateral, part of your frontal bone going towards, right? Zygomatic process frontal bone. Zygomatic bone itself, so you're seeing that over here. And then in the back, you have the sphenoid bone, greater wing of the sphenoid bone. Here you see the fissures, the inferior orbital fissure, right over here, and the superior orbital fissure, right over here. Okay, so you see the fissures. Floor, you have the zygomatic bone, and you have the maxillary bone. So that's what you're going to see. You have the maxillary bone, and you're going to see the zygomatic bone. Palatine bone, very little. I'm not going to ask. Let's move on to the medial. Medial, you have a lot of bones going on. You have your sphenoid body. You have your ethmoid bone, the lateral mass. That's what I was talking about. You have your lacrimal bone. You have your maxillary bone. So all these are going to be found over here. Sphenoid, ethmoid, maxillary, lacrimal, and of course nasal, all found in the medial wall of your orbits. So you basically need to know what are the bones that forms different or walls of your orbit. Paranasal sinus. So if you look at this picture, you can see there's an anterior view of the sinuses and as well as a lateral view of your sinus. So you can see in the anteriorly you have the 2 major sinus found in the maxillary bone, maxillary sinus, and you have the frontal sinus right in the frontal bone. But if you see the lateral view, you're going to see these ethmoid air cells. This is where I said they're located. Right behind the ethmoid, you have your sphenoid sinus. This is what I said. So you have your sphenoid body and the big large sinus of your sphenoid bone. So those are the sinuses that tend to get inflamed and that basically causes sinusitis. Even though mastoid bone has a sinus, we do not consider them as paranasal because the mastoid bone is nowhere near your nose. Para means around, nasal, right? So around your nose. So that's nowhere near your nose. Hence, we do not consider them as paranasal sinus. That concludes your facial bones and your cranial bones of your skull. There are other bone, which is called as a hyoid bone. It's a very unique U-shaped bone. It's basically bone that is not a bone of skull, nor it is articulated to any other bone. The sole purpose of hyoid bone is so that you have your pharyngeal muscles and muscles for speech to attach, somewhere to attach in between, right? So that's basically why you end up having these hyoid bone. So that concludes the skull portion of your skeletal system. Now we're moving on to the next part of the axioskeletal system, which is the vertebrae. Vertebrae, you have multiple irregular small bones that come together to form this vertebral column. You have these bones are divided into regions. You have your cervical region, thoracic, lumbar, sacrum, and coccygeal. Cervical region, you have 7 vertebrae to form your cervical region. Thoracic region has 12 thoracic vertebrae to help to form your thoracic cage. Lumbar vertebrae are 5. Sacrum are fused bones inferior to the lumbar vertebrae, and coccyx also are fused bone that forms your tailbone. Now, if you look at your vertebral column, they're not straight. There are a lot of curves that you see in your vertebral column. The curvatures, when you look at it, you have 2 posteriorly concave curvature in your cervical and lumbar region. You can actually see them concave. You can feel those curves when you just go over with your hand your vertebral column. You can see the curve in your cervical area and curve in your lumbar region. So those are the 2 cervical and lumbar concave curvature. And then you have 2 posteriorly convex curvature, which comes out, which will be the thoracic region and the sacral region. Okay. The S-shaped curve is very, very important. If you do not have this S-shaped curve in your vertebrae, it leads to a lot of homeostatic imbalances. Those are your scoliosis. So it's not straight down, it's kind of curved laterally. So that's scoliosis. Kyphosis is hunchback. So the curve is more forward. That's hunchback, kyphosis. Lordosis is sway back, especially in a pregnant woman. You can see how she moves backward a little bit to balance her weight. Or if a person is overweight and has too much weight in the abdominal region, they also kind of sway back. So that's why it's called a sway back or lordosis. Okay, so those are the abnormal spine curvature. Why do you need the spine curvature? You need it to be straight down the middle, and you need this S-shaped curve. Why? Because the entire body weight distribution from your upper body to your lower body depends on how straight your vertebrae is located. So when you sit, when you're not sitting straight, the weight goes in the lumbar area, and that's why you have lower back pain. And when you walk, you don't hunch back, otherwise you're going to have, again, lower back pain. Now, this arrangement of vertebrae, one on top of each other, they don't just randomly sit on top of each other, but they are actually held on together by a lot of ligaments. The ligaments that you have are your anterior and posterior longitudinal ligaments from neck to sacrum. Ligamentum flavum connects adjacent vertebrae. And between each vertebrae, above and below, you have short ligaments. Okay, so here you can see the ligamentum flavum right over here. And you have the anterior longitudinal ligament, and then you have the posterior longitudinal ligament over here. When the vertebrae sits on top of each other, the body doesn't sit on top of each other of the vertebrae, because then they'll cause friction and the bone is going to rub against each other. In between, you have the intervertebral discs. These white structure between the body of the vertebrae are called as intervertebral discs. These discs have 2 portions. One is the outside annulus fibrosus, and the other one is the inside nucleus pulposus. The nucleus pulposus is a soft, cushiony area. Annulus fibrosus is a tough area. Make sure that the nucleus pulposus stays inside. When this disc comes out of its origin or of its normal alignment is when you have slipped disc. And that's what we call a slip disc. In the next picture, you can see how the disc has moved. And here's the the whole thing is a disc, and you can see the disc has moved out of its alignment. And because you have spinal cord right there, it presses coming out of the spinal cord, causing pain. Okay, so that's why people have, if they have a cervical herniated disc, then the upper limbs are going to be affected. If it is a lumbar region, which is more common, it's going to affect the lower limbs. Okay, that's herniated intervertebral disc. All right, let's look at the general structure of the vertebrae itself. Okay, so here's a general view of the vertebrae. This is how a normal vertebrae is going to look. It's going to have a big body. It's going to have the hole through which the spinal cord has to go through. This hole is called as the vertebral foramen. And the arch that forms is the vertebral arch. Okay, and it has processes. You have the two transverse process. Transverse means to the lateral. And you have the spinous process going straight to the posterior view. So the anterior side, where the abdomen is going to be, or the thoracic, the heart and lungs are going to be, is going to be the body facing. The posterior is going to be the spinous processes. Okay, that's what you feel. If you have less fat over there, you're going to feel the spinous processes. So you have all the processes, and you have the body and the foramen, vertebral foramen. And then you have areas which the other vertebrae sits on. Okay, those are called as facets. Okay, so you have a superior articular facet, and then the same thing is found inferiorly as well. Remember, the vertebrae is stacking upon each other, meaning one vertebrae is going to be sandwiched between the one above and the one below. So that means it has to have facet. Remember, facet is for articulation purpose. So it's going to be found both superiorly and inferiorly of the vertebrae. So it can bind to the vertebrae above and below, or it can join rather. Okay. So these are the general parts of a vertebrae. Now let's look at individual vertebrae. I said there are different regions. You have your cervical region, thoracic region, lumbar region, and then you have the sacrum and coccyx, right? Each vertebrae of each region can be distinguished from the other. It's absolutely necessary for you to know how to distinguish one vertebrae from one region to another region, right? Your cervical vertebrae doesn't have much to hold. The weight is not going to be much. It's just your head. It's your head with brain, blood vessels, and all those things that are going to sit on your cervical vertebrae. You have 7 bones in your cervical vertebrae. Okay, they're the smallest and lightest vertebrae because they don't bear that much weight of your body. C1 and C2 are going to be different. We name each vertebrae by the letter from which region it comes. C1 for C for cervical. If it is T, it'll be thoracic. If it is L, it'll be lumbar. Okay. Sacrum and coccyx, because it is fused, we just call it sacrum and coccyx. Okay. C1 to C7. That's basically how you number the vertebrae. C1 and C2 are going to be completely different. We're going to focus on C3 to C7. How do they look? If you look at the C3 to C7 vertebrae, first off, you're going to see there is a triangular shaped foramen. So the vertebral foramen that I showed you before in a general view is now not round, but it's going to be triangular shaped. Okay. The transverse process is completely not prominent as it should, and it also has a foramen inside. It's called as transverse foramen. Transverse foramen is found in all your cervical vertebrae. It is because the vertebral artery goes through the transverse foramen. That is why you have transverse foramen in all your cervical vertebrae. Okay. What else is different? The body is oval shaped. So you see the body is oval shaped over here. Triangular shaped vertebral foramen, oval shaped body, transverse foramen found in the transverse process. You have facets for the articulation or joint above and below. So you have inferior facet below, superior facet. You can see that over here in this picture. You have the superior facet over here and inferior facet over here. This is the process, superior and inferior. Here, spinous process is bifid. You have 2 horns, right? So it's bifid. So you have your spinous process, which is bifid. That is very unique to your cervical vertebrae itself. Okay. So that is the general characteristics of your cervical vertebrae, C3 to C7. Now let's look at the first vertebrae. First vertebrae of your body is called as an atlas. Atlas because it holds the globe of your skull, right? So that's basically why it is called as atlas. Now the atlas, because of the joint to your skull, does not have a spinous process posteriorly. It has a tubercle instead, posterior tubercle. You don't see a triangular shaped foramen, vertebral foramen. You have a large space. You do not have a nice body in your atlas. Instead, you have an arch. That's basically what you're going to see, a posterior and an anterior arch. You have a large facet, superior articular facet. Remember, it sits on the condyle of your occipital. That's going to sit on the superior articular facet. You're going to have transverse foramen here as well. Inferiorly, you're going to see the inferior articular facet, which is going to sit on C2. Okay, C2 is called as axis. That's what we're going to talk about next. So this is your atlas. C2 is your axis. C2 axis is very unique. Over here you can see there is a little bit tiny spinous process is already formed, almost a triangular shaped vertebral foramen, a superior articular facet that joins with C1, okay, C1, and then you have dens. You're not able to see the dens over here. So if you look at the lateral view of your vertebrae, you're going to see something like this. So this is the dens portion sticking upward. The dens is going to sit on, the atlas is going to sit around it like that. It's a very crude drawing, bear with me. So the atlas is on top and the dens is going to stick upward towards the atlas over here. Okay, so that's the purpose of dens. So your atlas can move and you can rotate your head. No action is because of that lateral movement of your head, is because of this dens. The atlas moves around right and left lateral because of the dens. Okay, so that's basically what you're going to see over here. It has a transverse process and a foramina, which is not viewed over here, and you have the lamina as well. Okay, so that concludes your cervical vertebrae. The next vertebrae is your thoracic vertebrae. Thoracic vertebrae is also unique in its own way because it helps to form thoracic cage. Thoracic cage is formed by the vertebrae posteriorly, anteriorly sternum, and on both sides laterally you have the ribs going along. So the ribs go from the vertebrae all the way to sternum and eventually attaches to this, most of them attaches to the sternum. Okay. Let's look at the vertebrae itself. It needs a joint or facet for the ribs to attach. That's exactly what you're going to see. So you have your transverse costal. Costal means ribs. Okay, you have the costal facet over here. You have the costal facet over here, inferior costal facet over here, superior costal facet over here of the rib. So the rib head, it's going to sit over here. It's going to curve around like this, okay, and go anteriorly to your sternum. So it's going to go all the way like that and attach to the sternum. Okay. So you have facet, superior costal facet, inferior costal facet, transverse costal facet for your ribs attachment. For the actual vertebrae to vertebrae itself, you have the articular process and the facet superior, and the body shape of your thoracic vertebrae is going to be heart-shaped right over here. The vertebral foramina is going to be round. The transverse process, because it has function, is very prominent without any transverse foramina. Spinous process is also prominent. The longest spinous process is going to be C7 in your cervical vertebrae. Okay, these spinous processes are going to be lesser compared to that. Okay, so that's basically what you're going to see. Okay, lumbar, L1 to L5 it's very easy to locate your lumbar. It's the most thickest vertebrae that you have because all your upper body weight goes on these guys. There's no purpose, there's no ribs attaching in the lumbar region, so the transverse process is very, very thin. It has a very nice superior and inferior articular facet. It forms a great notch over here, so it kind of locks in. So your rotation stops at the thoracic region. Your lumbar does not move much. Between the bones, there's no movements there. The body is oval shaped like your cervical vertebrae. Triangular shape, vertebral foramen like your cervical vertebrae as well. Spinous processes, very, very thick body. You can see that over here, very large body itself. Okay, moving on to the sacrum. It is fused bone like you can see over here, and that's basically what you're seeing in this area. It has these holes, we call it as sacral foramina, through which all your nerves and everything comes out. The sacral promontory sits on the lumbar L5, and then it has the ala. Ala means wings right over here. This ala forms the posterior wall of your pubic cavity. So your pelvic bone is going to come like that on both sides, right? So it's going to attach over here. Inferiorly, you have your coccyx attaching to the sacrum. I'm not going to ask too many questions in this area. Now we've finished the skull, we've finished the vertebral column, we're left with the thoracic cage. Let's look at the thoracic cage. Here are your ribs and how they attach and form your thoracic cage. Thoracic cage, posteriorly formed by your vertebrae. Anteriorly, you have the sternum right here. Posteriorly, the vertebrae over here. Thoracic vertebrae, T1 to T12. All your ribs. So your ribs, you're going to have 12 on each side. That means 24 ribs total. So both your right and left side ribs are going to attach to the vertebrae posteriorly. All of them do. All 12 ribs are going to attach. Now, anteriorly to the sternum is a different scenario. Okay, anteriorly only the first 7 ribs attach, hence they're called as true ribs. The attachment is posteriorly to the vertebrae and anteriorly to the sternum, hence they're called as true ribs. The 8 to 12 are called as false ribs, and the last 2 over here are called as floating ribs of the false ribs, the 11th and 12th. Okay, why are they called as false ribs? They are called as false ribs because you can see there is no direct attachment to the sternum. They attach to the 7th, and that's your 11, and that's your 12. Okay, 11 and 12 are floating ribs. So the 8th one attaches to the 7th one indirectly. Okay, so by indirectly attaching to the 7th one, they indirectly attach to the sternum, right? And the 9th and the 10th, they all attach to the 7th and indirectly attaches to the sternum. The 11th and 12th, they are the outliers. They don't care whether they attach to the sternum or not. They just are there. They're floating ribs right over here. Now let's look at the sternum itself. Sternum has 3 parts. You have the handle portion, manubrium, right over here. And then you have the body, right over here. Okay, body, and then the tip, which is xiphoid process. Okay, xiphoid process is cartilage until you turn 40. It is cartilage. After that, it starts to calcify over here. Okay, so these are the 3 portions of your sternum. Let's see if we can look at how the ribs attaches to your vertebrae posteriorly. So here's your thoracic vertebrae. So you can see 2 vertebrae over there and 1 rib. They're basically forming the attachment with the ribs itself. So 2 vertebrae, and you have the transverse process. You can see how the head of the rib is actually between the 2 vertebrae. Okay, so you have the superior costal facet of this vertebrae over here, and the inferior costal facet of this vertebrae up here. So the head of the rib goes all the way over here. It curves, And here you have the angle of the ribs, which sits on the transverse. This is your transverse process of this vertebrae. So it sits on the transverse costal facet and then goes all the way in the front and attaches to the sternum. Okay, if it attaches to the sternum. If not, then if it is a false rib, then you know what it does, right? So this is basically how the joint is formed. Here's another picture, and you can see clearly how they form the joint. So you can see how the head of the rib sits on the facet, one superior and the other one should be inferior. It curves around. Here's the transverse process and the transverse costal facet joints. The neck of the rib is this narrowed portion, and you have the tubercle of the rib that forms the facet between the transverse facet of the vertebrae itself and forms the joint. There are tiny ligaments that make sure that it attaches and forms a firm rib. And this is how you have articulation between a rib and a thoracic vertebrae. With this, we conclude our axial skeletal system. Here we're looking at your appendicular skeletal system. We're going to start off with the upper limbs. Appendicular skeletal system includes your limbs and the girdles that attaches to the axial skeletal system. So here you see your upper limb, that's your humerus, and the girdles. This will be the scapula and the clavicle. So the upper girdle includes the scapula and the clavicle. Okay, so let's start with the clavicle. Clavicle itself is an S-shaped bone. That's what you're looking at. It's a superior view. Superior view is from this side, right? From top. So you're looking at it in this direction from top. So the superior view, you have the S-shaped structure. You have the sternal end and you have the acromial end. Okay. Anterior, that means towards the thoracic cage, posterior towards the vertebrae. So this curve should be always towards the vertebrae, and this one should be towards the rib cage. So here's the sternum, and here's the acromial. If you look at the inferior view, there is no picture, but the inferior view is going to have a lot of grooves because the muscles are going to attach. It's not going to be as smooth as the superior view of your clavicle. Other than this, there's nothing much in your clavicle. Let's move on to the scapula. Okay, scapula. The area where it is facing the rib cage is going to be smooth. Okay, so you're going to have the smooth area, which is what we call it as subscapular fossa. Okay, that's going to be facing your rib cage. Okay, so the area that is behind, that you can actually feel from the back, is where your spine is going to be. Let me show you another picture eventually. Let's look at this anterior view. Anterior because it's facing the rib cage, hence it's called as the anterior view. This whole triangular smooth area that you see over here facing the rib cage is called as subscapular fossa. The scapula has borders. So you have the medial border because the vertebrae is going to be over here. So hence the medial border towards the midline. The lateral border towards the humerus because your head of the humerus is going to sit and your arms are going to come off like that. The head of the humerus is going to sit in a shallow cavity called as glenoid cavity right over here. There is an inferior angle and then you have a superior border on top and superior angle. Okay. There are two processes. You have a coracoid process. Remember, in your mandible, you have coronoid process. Make sure you get the spelling right. Coracoid process is right over here. And then you have your acromion. Let's look at the posterior view of your scapula now. The posterior view, like I said, is not going to be smooth. It's going to have a spine right over here, which ends in your acromion, right here. Okay. The spine actually divides the scapula into two fossa. You have your infraspinous fossa and your supraspinous fossa over here. That's basically what you see posteriorly, the spine and two fossas above and below, supraspinous, infraspinous, acromion, much clearer as it proceeds. A little bit of glenoid cavity is also viewed. So that basically is your scapula. Now you have to identify which scapula it is. Okay, so what I do to identify the scapula is I make sure that the spine is first posteriorly located. Once I get the spine posteriorly, I know that this will be the medial surface because the vertebrae is going to be over here. Glenoid cavity is going to be over here. That's where the humerus is going to sit, right? So that means this will be your right scapula. Okay, so you have to identify which bone it is, right side or the left side, based on all the structures that I showed you. You first identify the spine, you know it's going to be posterior. Then you see the glenoid cavity. Then you know the vertebrae is going to be towards the medial border. So you know that this is going to be the right scapula. Okay. Moving on from the scapula to your upper limbs. We start off with your humerus. Okay. Humerus is the longest bone of your upper limb. So you have this head of the humerus, which is going to sit on the shallow glenoid cavity of your scapula. You have the neck region, which is the anatomical neck over here. And then you have two tubercles, 1 and 2. The greater tubercle, lesser tubercle. Between that, you have your sulcus. Sulcus is a groove, shallow groove, right? Intertubercular sulcus. Deltoid tuberosity, this is where your deltoid muscle from your shoulder attaches to, deltoid tuberosity. Now, here's the thing. You again have to identify which scapula or humerus it is, right side or left side. For that, you need to know the inferior portion. The superior, or you call it as proximal epiphysis, diaphysis, and this is the distal epiphysis right over here. So you look at the distal epiphysis portion of your humerus and look at the structures. This one right here is the capitulum, head. This portion right here is the trochlea. Trochlea is pulley-shaped structure, like a pulley. Okay. And then you have the medial epicondyle. Right above this, you have two fossa. You have your coronoid fossa and you have your radial fossa. Okay. So when you see two fossae, you automatically know that it should be anterior view. And when you see the medial epicondyle is the one that you can feel in your body. And this is where the ulnar nerve passes. The ulnar nerve passes along the medial epicondyle, and when you strike it, that's the funny bone that you're striking. That's what hurts a lot, because the ulnar nerve goes right on medial epicondyle, and when you strike it, it's striking the ulnar nerve, which causes the pain. Okay, so medial epicondyle, it should be towards the midline, right? So here's the medial epicondyle, and here's the midline right in the center, right? So it should face the middle portion. That's another clue. The two fossa that you see are another clue. Coronoid fossa towards the midline, right above the trochlea. Radial fossa right above the capitulum. Okay, this is the anterior view. If you look at the posterior view of your bone, so this basically is the posterior view of both your ulnar and radius of your forearm, as well as the humerus. Okay, so here's the humerus, here's your ulna, here's your radius, right? Posteriorly, you can see one giant fossa right over here. It's called as olecranon fossa. Okay, the fossa are named after the structures that reside in it. So here's the anterior view of your humerus. You have the capitulum. Above that is the radial fossa. Here's the trochlea. Above that is the coronoid fossa. Remember, coronoid process of your mandible. This is your coronoid fossa of your humerus. Same name, different structures. Okay. So when you have these radius towards the lateral view, remember anatomical position, your palm is facing forward, right? So the radius, which is towards your thumb, okay, that is going to sit on the capitulum of your humerus. Here's the head of the radius sitting on the capitulum. Capitulum also means head. And when you bend your elbow, The head of the radius goes inside the radial fossa, hence radial fossa. Trochlear, basically it's a pulley shaped, is where your ulna sits. When you look at your ulna, you'll realize that the ulna is somewhat like a claw-shaped structure. So here's your ulna. Okay, so it's a claw-shaped structure like this. The olecranon process sits posteriorly, and the coronoid process sits anteriorly. Now, the coronoid process is going to sit where? In your coronoid fossa of your humerus. You remember coronoid fossa is found anteriorly of your humerus. So this process, when you bend your elbow, goes directly into your coronoid fossa of your humerus. Olecranon process sits posteriorly in the olecranon fossa of your humerus posteriorly. This area is where your trochlea of your humerus sits. Hence, this is called as trochlear notch. So each individual names are based on what structure is going to sit on. So here, posteriorly, you see the olecranon process, olecranon fossa of the humerus. They're making a joint over there. Anteriorly, you see the coronoid process goes into the coronoid fossa of your humerus when you bend your elbow. The trochlear notch sits on the trochlea of your humerus. Posteriorly, you can see the olecranon process going to the olecranon fossa. Okay? That's your ulna. Radius we already talked about. Head of the radius in joins at the capitulum. When you bend your elbow, it goes to the radial fossa anteriorly. There is no posterior structure to your radius, hence there is no fossa posteriorly in your humerus. And this basically is what forms your elbow. So you need to know all the process, what it sits on, and how it sits on in your elbow. Okay. The radius and ulna of your forearm are actually movable. In between the radius and ulna, you have an interosseous membrane. Because they are movable interosseous membrane, you're able to supinate and pronate, meaning you're able to form a palm or you're able to show the backside of your hand. Supinate is like holding a bowl of soup where your palms are facing upwards. Pronate is opposite of that. Okay. So that process is because of these interosseous membrane. The radius crosses your ulna when you move the direction of your palm. Okay, so that completes your upper arm and your forearm. Your hand. Let's talk about the wrist itself. Okay. The wrists are made of 8 bones in 2 rows. Okay. I'm not going to ask all the bone names. All you need to know, they form 2 rows, proximal row and distal row. And your bones, radius, articulate with the wrist to form your wrist, with these bones to form your wrist joint. Okay. Now let's move on to your hands. Your hands are made of small, tiny bones. The palm is made of metacarpals. Okay, so these are also considered as long bones because the length is more than the width of the bone. So these are also considered as long bones. So you have metacarpals, and then you have the phalanges. The phalanges, you have 3. You have the distal, middle, and proximal phalanx. But your thumb, you don't have the middle. You only have the proximal and you have the distal. You don't have the middle in between. So this is all you need to know about your hand. So we finished your upper girdle and your upper limb. We're moving on to the lower girdle and your lower limbs. Lower girdle is actually made of 3 different bones fused together. So if you look at this picture, you'll see that there are different bones that actually forms this perfectly shaped pelvis of your body. Sacrum is right here. I told you the sacrum forms the posterior wall of your pelvis. So here's the ilium. Ilium stops somewhere over here and starts your pubic. Pubic stops somewhere over here, and here's your ischium. Okay. So let's look at the colored version so you know it better how it starts and stops, right? So here's the lateral view. Here's the upper bone, upper It's superior posterior bone. That'll be your ilium. Okay, that's why it's called as iliac region, right? So ilium. And then you have inferior posterior is your ischium. And then you have the inferior anterior, which is the pubis. So all these three bones fuse together to form your pubic region. You have two pubic bones, or hip bones rather. So that'll be your right hip bone and left hip bone. Okay, when you get the model, you're going to get a hip bone, not individual ilium, ischium, and pubic. That's impossible to cut through it. Okay, so now let's look at all the structures, lateral view. So let's start with the ilium. The topmost area right over here is the iliac crest. This entire wing-shaped structure is the ala. So the anteriorly, you have your fossa. Right over here, there's a depression going on over here. That depression is called as the iliac fossa. The top view is the crest, iliac crest, right here. You can actually feel this area. Okay, you can feel it. That is the anterior superior iliac spine. And then underneath that, you have your anterior inferior iliac spine. You have the same thing going on in the posterior superior iliac spine, right over here, and posterior inferior iliac spine. Okay, so you have the crest, you have the fossa, you have the anterior superior, anterior inferior iliac spine, you have the posterior superior iliac spine, and posterior inferior iliac spine. If you follow along the fossa, you form a line. You see this over here? This is the fossa. Right over here is the fossa. And you see this over here, the continuation? This line that you see is the arcuate line. And that's what you're seeing over here in this picture. This is the arcuate line, which is continuous to the pubic bone. So you see over here, pubic bone, and it continues over here. And it continues backwards to the sacrum as well. And then forms a round, goes to the left side, because this is the right hip bone, goes to the left side and joins over here at the pubic symphysis. Okay, so that's the arcuate line. It's very important structure. We'll talk about it when we get to it later. Okay, that is your ilium. Let's look at the posterior view of your ilium. Okay, this is actually lateral, but you can see the posterior as well. Here's your posterior superior spine. Here's your posterior inferior spine. Underneath that, you have this little notch, actually greater notch. That's what it's called as. Greater sciatic notch. That's a greater sciatic notch. When you have greater sciatic notch, automatically this end should be posterior towards the sacrum. Okay, this space that you see over here is formed by all three bones, and this is where the head of the femur sits in. It's called as acetabulum. All right, so the next type of bone that forms your hip bone is your ischium. I said it is inferior posteriorly located, so it's right over here. This rough area that you see is the ischial tuberosity, and this is actually where you sit on. Sometimes if you sit for too long, this hurts, right? This is because this tuberosity is pressing against your soft tissue of your gluteus maximus and minimus, right? So that's your ischial tuberosity. If you follow along the greater sciatic notch, you end up with the spine. That's your ischial spine. Okay. Under the ischial spine, you have another smaller notch over here. That notch is your lesser sciatic notch. Okay, so lesser sciatic notch is found in the ischial bone. Greater sciatic notch is found in the ilium bone. Okay. So those are the features that you need to know in your ischium. Now let's move on to the pubis. Okay, pubis is the inferior anteriorly located. It's very straightforward bone. There is not much going on over here. You have the ramus, inferior superior ramus, and then in the anteriorly, you have the surface for the pubic symphysis attachment. So that's all there is for your pubis. So those are the structures of your hip bone. Now, based on your hip bone, you can actually identify whether it is a female's body or a male's body. Okay, so that basically takes us to the next part of the chapter, comparison between male and female pelvises. Female pelvis is made so that the female can give birth. So it's going to be lighter, thinner, and smoother. Male, there's no birth giving, so it is going to be heavier, thicker, and with prominent muscle markings, right? Prominent markings. Pubic arch is going to be different. What is pubic arch? Pubic arch is this area between the two pubic bone. This is the inferior ramus. So you can see that between the pubic bone over here, this is the pubic arch. If it is broader, that means it's going to be female. If it is narrower, that means it's going to be male. Okay? If it is broader, that means this area is moving laterally. Okay? If this area moves laterally, for example, the pubic arch, say it's like this. This is actually an example of a female pelvic bone. This whole area moves laterally if the arch is too big. If it moves laterally, this area, space inside, also opens up. This is the pelvic brim. Why is the pelvic brim so important? Because it is this area through which the head of the fetus comes through, the baby comes out of, right? This is where your pelvic diaphragm is formed as well. So it has to pass through this area. The pelvic brim is bigger, then the head of the baby can easily pass through. If it is smaller, then it can't. So the pubic arch plays an important role as well. Now let's talk about the acetabula. Acetabula is where the head of the femur sits in. It's going to be smaller and further apart because now the pubic arch is more, the angle is more, so it's going to push it laterally like I said. But in male, it's going to be closer and large compared to them. Sacrum. Sacrum is going to be shorter, wider, and the curvature is accentuated. Let's look at this picture over here. So here is the sacrum. You can see how it is accentuated over here. The curvature is accentuated. Compared to over here, it's almost straight. The sacrum is straight. The acetabula is smaller, and you can see how large is the acetabula in male. Okay, so next, coccyx. Coccyx has to provide the head so it can move inside the head of the fetus, right? So it has to be movable and more straight in female. This curves ventrally towards anteriorly. Okay, so here's the picture. You can see how the coccyx is almost straight. This one has a deep curvature over here. You can see how deep it is, moves ventrally. That's absolutely necessary. Here's another picture. You're seeing the inferior view. You can see the pelvic brim, how big it is. That's where the head passes through. Okay, and you can see the pelvic brim in a male. It's hardly anything can pass through, right? So that's very, very important for childbirth. You can see because of the arch being broader, 90 degrees almost, you can see the acetabula on the sides over here, laterally located. Acetabula is more medially located over here, and they're larger. Okay, so those are the differences that you see in male and female pelvises. So that finishes pelvic girdle. We're moving on to the lower limb. The largest, strongest bone that you have in your body is your femur. Femur, the head of the femur, sits in the acetabula of your hip bone. You have the neck portion, that's the narrow region. You have, this is the anterior view, this is the posterior view of the femur. Please make sure that you read what is written in the bottom of the picture. The anteriorly, you have a line that is intertrochanteric line. Just like the tubercle that you saw in the humerus, this is trochanter because it's more prominent. Posteriorly, you can see the greater trochanter and you can see the lesser trochanter posteriorly. You can see the intertrochanteric crest line is much more fainter than the crest. So the more prominent it is, it's called as a crest. It's found posteriorly. Anteriorly, you have just a line. The shaft of your femur, and then you have the distal epiphyseal region. The lateral epicondyle, right over here is the lateral epicondyle. You have the medial epicondyle over here in this region, right over here. Above the medial epicondyle, you have a tubercle. Okay, it's the adductor tubercle. Your adductor muscles attached to it. Adductors are found medially because your head of the femur is also medially located. Remember, you have to know how to identify whether it is right or left. Limb bones. Same goes with the girdles as well. Anteriorly, you have a patellar surface. This is where the patella sits in, so you have a smooth surface over here. Posteriorly, on the other hand, you have a fossa actually. So intercondylar fossa. What are the condyles? Condyles are where your tibia sits on. So you have the lateral condyle and you have the medial condyle over here. Okay? So condyle is where your joint is formed between the femur and the tibia. So this is basically what sits on the tibia. Hence you have the condyle. And in between the condyle, you have the fossa posteriorly of your femur. Okay? So that's all there is to your femur. Moving on to your tibia. Your knee joint is basically formed by 3 bones. You have your femur, you have the tibia, and you have the patella. So all these 3 together forms your knee joint. Fibula, which is towards your small toe, does not play a role in your knee joint. Okay? It is just there to support your tibia. It does not play an important role in your knee joint. So if you look at the superior surface of your tibia, you see the articular surface. This is where your condyles of your femur are going to sit. So you have the lateral condyle and you have the medial. How do I know this is lateral? Because your fibula is there. Fibula is towards your small toe, which is lateral. Okay? So that's why this is the lateral condyle and this is a medial condyle. Okay, in between the condyle you have a horn shaped like a mountain peak, right? That is what we call it as intercondylar eminence. So you can see this intercondylar eminence over here. Anteriorly you have this rough area. This is what we call it as tibial tuberosity. Your femur, your quadriceps, attaches inside the ligaments of the quadriceps. You have the patella, and the patella ligament attaches to your tibial tuberosity. That's how it forms your knee joint. In the shaft area of your tibia, you have a sharp border. That'll be your anterior border. This is where you actually do not have any fat. You can actually feel this border against your skin. Okay, that's your anterior border. Your distal epiphyseal end has your medial malleolus. Medial malleolus is what have your ankle. The little bump in your medial side of your ankle is due to your medial malleolus. The lateral bump of your ankle is due to the lateral malleolus of your fibula. Fibula, there isn't much parts that you need to know. Head, fibula, body, and then you have the lateral malleolus. There is a joint between the tibia and the fibula, distal tibiofibular joint and proximal tibiofibular joint. That's all you need to know in your tibia and fibula. Moving on to the foot. Under the foot, you need to know a few bones. Okay? You need to know that your talus, that's the first bone that you need to know. You need to know your calcaneus. The calcaneus have calcaneal tuberosity. The calcaneal tuberosity is what forms your heel. So your heel basically forms like that, and there's your foot, and that's your shank, and here is your foot being formed. So it's basically like that. Okay, so your tibia is going to sit over here. So that's the facet for your medial malleolus. You can see over here. So your tibia, medial malleolus of your tibia is going to sit over here. That's the medial bump that you're going to see in your ankle. Okay, now the calcaneal tuberosity forms the heel. That means the weight from your upper body goes to your vertebrae, to your lumbar vertebrae, distributes to your 2 hip bones, goes to your femur. From the femur goes to your tibia, because that's what forms the knee joint. Tibia to your talus, to your calcaneal, and all the bones of your feet. Okay, that's how the weight distribution is. Okay, that's why it is important to have your vertebral alignment straight. Otherwise, the weight is going to be imbalanced, and you're going to have, if you have lower back pain, you're going to have foot pain and all those things. Your foot has a lot of ligaments that hold together your tarsal, metatarsal, and all the bones of your phalanges. Yeah. The ligaments actually help to form arches of your foot. So you have the medial longitudinal arch, you have the lateral longitudinal arch. Okay, so if you have your foot like this, right, you have this is my lateral and this is my big toe. So here is the medial longitudinal arch, and then one goes across, that'll be your transverse arch. So that basically is all you need to know in your foot and the bones. The last portion of the chapter is your developmental aspect. We're going to stop at and look at the fontanelles of the fetal skull, okay, or even the newborn. The fontanelles are the fibrous membrane that hasn't yet calcified and ossified. This is the soft spot that I talked about when I was discussing the bone ossification, intramembranous bone ossification. Okay, so you have an anterior fontanelle, you have one posterior fontanelle. Laterally, you have a mastoid fontanelle and you have a sphenoid fontanelle. So wherever you have your cranial bones fusing together, you have your fontanelles, right? So that's basically what fontanelle, and the fontanelles are used to measure the growth of the baby after born, right? When the baby is born, the cranium is bigger. That means because there's a rapid neuronal development going on in the brain, hence the cranium is half the size of an adult size at 9 months of age, right? The mandible and maxilla are shorter compared to the head. That's why they kind of bob around. They fall off, right? They can't hold their head, partly also because of the heavy big head. And then the arms and legs grow faster than the head and trunk. Okay? When the baby is born, they are born only with thoracic and sacral curvature. There is no cervical and lumbar curvature. Okay, so the baby's curvature is going to be like a C-shaped curve. So if you look at this picture, you can see there is one big C-shaped curvature like that. You have the thoracic over here, and then you have the sacral over here. There is no lumbar, there is no cervical. Okay, because they're concave, remember, it goes like this. It's concave. There is no concave curvature over here when the baby is born. Okay, the reason is because the head is not being held by the neck. So the muscles haven't remodeled the area in this place and in the lumbar space. Okay, because the head is not being held high up and the body is not erect, there is not going to be any lumbar and there's not going to be any cervical curvature in a newborn. But as the baby starts to sit up, lifts the head, learns to walk, the weight is being distributed on the vertebral column, and slowly the secondary curvature starts to form. That'll be your cervical and lumbar curvatures of the vertebrae. As you get older, the intervertebral discs start to become thin, less hydrated, less elastic. The bones are already osteoporotic and they start rubbing against each other, hence the back pain, hence the risk of disc herniation. Okay, and because of the tiny minute fractures that happen in the body of the vertebrae, it seems like as though you lose your height as you get older. Okay, it is actually true. Loss of stature by several centimeters, common by age 55 because the vertebral disc also becomes thin, as well as tiny minute fractures starts happening in the body of the vertebrae because of osteoporosis starting. The cartilages that are found in the rib cage starts to calcify and hence the thoracic cage become rigid, hence you have trouble breathing. Overall, the bone starts to lose its mass as you get older because the osteoclast activity, which is breaking down of the bone, is predominant compared to osteoblasts, that is formation of the bone matrix. Now this completes your chapter 7.